Hello again. Okay, we're on to our next speaker. Innovation in health, regenerative medicine. That's what we're going to hear about next. And our next speaker is the ideal person to prize this subject open. Not only is he the director of CoreMed here in Graz, yes, but also the head of the Department of Plastic, Aesthetic and Reconstructive Surgery at the LKH University Hospital in Graz. And also his medical director. I don't know where you find the time, Lars-Peter. Please give a warm Graz welcome to Lars-Peter Kamolz.
So, hello everybody. I think English, is it good for you? Is German better? English? Okay, so I will stay in English. So my presentation this afternoon will deal about the healthcare future, a little bit about what is science and what is fiction. As you've heard, I'm a plastic surgeon, so I'm dealing mainly with reconstructive work, with burn surgery and so on and so forth. So sometime in the near future, that's how the most science fiction movie starts. And that's also the way I want to start. I want to make a short trailer or video of one of my favorite science fiction movies. It's not due to the fact that it's it's really a well-known movie, but on the other side it's really more or less the work which we are doing more or less on a daily basis. So I think that almost every one of you knows this movie. It's Star Wars and about the modification how Skywalker became Darth Vader. So if we are talking about this, do you think that this is more or less fiction or is it really science? So do you think that it's more or less realistic nowadays that a patient like this with a massive burn has a realistic chance to survive? And to tell you the truth, yes. So I think that the possibility to survive with this kind of burn is about 10% nowadays. And we will talk about the things which are already not fiction anymore, but which are already science. And this is the construction plan of his suit. So, and you will see that he has some cyborg implants, he has sensors included into his suit, he has other things, other devices, he has sensor enhancements, so a lot of things. But what of these things are really realistic? So let's go to the first thing. The first thing is bionic reconstruction. That's something we do more or less on a regular basis. So what we do right now is, for example, like in that patient who has lost both arms, what we can do is that we do target muscle re-innervation, which means that we take the nerves of the upper extremity and we re-innervate the great pectoralis muscle. And if the patient is thinking about special movements, different parts of the pectoralis muscle are acting, and the prosthesis know what kind of movements she has to perform. So we can do something like this on a regular basis. So this is not fiction anymore. The next things are sensors. And you will see just in the detail, you will always find these more or less marks of the different institutions of neonatal research. We are in total 7 institutions, and you will always see the institutions who are involved in these developments, what we're doing right now. So we have developed in the past different sensors for glucose, for potassium. We are developing sensors for wound infection. So these kind of sensor materials are really truth. They are not fiction anymore. They are really science, and we try to use them more and more also under clinical conditions. The next thing is 3D, 4D, bioprinting. I think that's something you all have read already in the newspapers. This is nothing new. So we do this in clinical practice. So there will be some changes in future because the next development like 4D print is already in the research field. Smart matrices and smart textiles. This is a very important aspect. So we have more and more not only sensor materials, we have also indicator materials. And I just want to show you something. Don't be afraid, it will not be a complete striptease. I just want to show you something that these are normal. I need exactly the right music for this. But these are, for example, these are the smart textiles you can use right now. And this was a development by a German company. And these shirts are able to cool down the body temperature and without any use of electronics. So just smart, intelligent textiles. And what we are doing right now is to test if these are possibilities that we do not have to cool down the room temperature, if we can cool down the body temperature by using these smart textiles. So there will be in future more and more of these materials. The other thing is that we have created indicator dressing materials which are changing the color if you're losing electrolytes, substances and so on and so forth, if your temperature is increasing and so on. So smart textiles, like they are involved in Darth Vader, they are not fiction anymore. They become real. Skin replacement strategies. Darth Vader got artificial skin, so this is nothing new for us. This is an example. You can see on the left side the hand immediately after the injury. That was a full thickness burn to the hand. Complete destroyed, the skin was completely destroyed. And on the right side you see the result 1 year after reconstruction. That's a combined reconstruction by use of a collagen elastin matrix in combination with the skin graft. And that matrix is of bovine origin. So these are technologies we have already more or less in clinical practice. Body hacking, you will see that we are not in this field, but this is an interesting topic. There are some people who are implanting magnets and so on, and you will probably have heard about the person who has the possibility to hear colors. So this topic is really interesting, but we are not in this field active. But what is really future? So how will the future, what are the things we have to keep in mind if we think about the future? Is it realistic to predict more than 10 years? No. I think it's realistic to say these things will happen during the next 10 years, but not more. And there are several reasons for this. And one of the reasons for this is that the medical knowledge we achieve is doubling every 7 months. And it's expecting that within the next year, this doubling phase will decrease down to 2 months. So this will be one of the biggest problems for us. How will we handle all this information? How will we filter all this information? So this will be at least a hotspot, especially if we're dealing about healthcare. The other big problem is the demographic change. You see that the number of old people older than 80 years, this is the fastest growing segment. And you see that 6 times within more or less 50 years, there will be 6 times more old people, not only in Asia, but also in Europe and in America. So this will be an important topic we have to deal with. The other thing is, we are talking about longevity. How can we change the median life expectancy? We have to keep in mind that at least we do not have to think too much about longevity. We should change the final 10 to 15 years, because nowadays the people are getting about 80 years, but the last 10 to 15 years they have a lot of comorbidities, and these are the things we have to change. So we have to think about that at least function or healthy life is probably more important than just becoming very old. I think we have to change. In the past century, we have to especially treat infectious diseases because this was more or less the killer number one. But nowadays we have to deal with the chronic diseases, with the chronic degenerative diseases which are coming more or less in the later phase of our lives. I think that at least that we have to die is very important. I think because this gives meaning to our life, and on the other side we know that we have to die because otherwise there will be a massive problem with overpopulation. So I think our focus has changed a little bit from anti-aging to healthy aging. We don't want to stay 25 or 30 forever. We just want to get older, but we want to age in a healthy way. What is the next problem? The next problem we have to deal is climate change and pollution. This is one of the biggest killers, and it's 3 times the number of deaths by AIDS, tuberculosis, and malaria all together. So this is an important topic we have to deal as doctors in future. And this is was a really excellent publication in the Nature magazine, where one of the authors has stated that right now we are conducting a real big or massive toxicological experiment in our world. The next problem is climate change, as I mentioned, and this is really a problem in the bigger towns. I think you know that, because you feel the difference when you're in the town. The temperature is staying there, it's stored more or less there, and this is really a problem. And during the year 2003 we had 30,000 deaths in Europe just to these heat waves. So this will become a very important topic, and you see here, this is Vienna in 2020 and this is Vienna in 2050, so this issue will become bigger and bigger, so we have to take care about this right now. So we have this effect, especially in the towns, and we have to change how we are planning our cities. And one possibility is, of course, we can paint all our roofs white, then Graz would look like a little bit like Mykonos. But you know probably that Graz has more or less a world cultural heritage for its rooftops, so that will be not Graz again if we paint all these, more or less, these rooftops white. But we have to change something. And this is for an example what the Research Institute Life is doing. They created a biosphere on top of their building at the Science Tower in Graz. And on the top you have several possibilities. You can change the climate, you can change the temperature, you can produce food, and you can harvest energy. So these things are the things we have to change in future if we want to become older or healthy older. So what are the key technologies if we're dealing with medicine in future? So number one is regenerative medicine, because I'm working in that field, so it must be the most important thing. The other one, of course, is artificial intelligence, telemedicine and telerobotics. So these 3 topics are the hotspots for future. Concerning regenerative medicine, what we're trying to do is that we try to heal or replace tissue, organs, which is more or less harmed or destroyed by age, disease, and trauma. Or we want to change or normalize congenital defects. So this is the primary aim of regenerative medicine. And I'm especially focused in induced autoregeneration, which means that we try to enforce the body to heal by itself. So I think that all these technologies are more or less ready to use and are available. So I think that these technologies will be established or will come into clinical routine very soon. We are not talking about 2 to 3 years, but 10 to 20 or 30 years. I think this will be a possibility. If we're talking about telemedicine and telerobotics, this is a very interesting topic. Because I think that we can use this technology, especially in areas where we have no medical care, that might be in the third world, that might be in outer space, if we're thinking about space missions. Because if there is a problem and no doctor is on board, we have to find solutions for that. So I think in future that especially telemedicine and telerobotics will work not only for the diagnosis, it will work for teleconsultation, it will be used for telecare, for therapies, but also for monitoring patients. So this is really a big and broad spectrum, and I think that this is really very important. Robotic surgery, you all know minimal invasive surgery. This was the hotspot in the last century. And the next step is robotic surgery, especially if we're talking about precise things and we have to do it in a rapid way, always the same activity, then probably the robot is better than the surgeon. If you have to do different things and more or less there are different ways how to do so, I still think that the plastic surgeon or the surgeons in general is better than the robot. But for some things it might be useful, and these will be more and more indication for this. And I think it's especially interesting for geographic areas with barriers or limited resources, like I've told you. I think there will be fixed ones installed in the hospitals, more or less mobile ones in ambulances or in spaceships or anything like this, but there will be also fully portable systems. Augmented reality, we will use this in a clinical or a daily routine for training and for teaching. There are already the first studies and pilot trials done with this, but this will become standard very, very soon, and I think this will even help us to perform better education. Artificial intelligence, that is also one hotspot in our institution. So what we're doing right now is a decision support system. So health has created a decision support, especially for diabetes care, where the system is already recommending the doctor to give the insulin. So this is really more or less in clinical routine. So we are using this technology in our department. So this is something we will have at least, because as I've told you, the knowledge will become bigger and bigger. So this will be the only way how we can handle this massive data, is the way that we are using big data management and we are using decision support systems. The other topic, which is also one of our projects in my institution, is data aggregation and visualization, how a doctor or a nurse or physiotherapist can deal with the patient history. A lot of our patients come with a printed out sheet with his more or less medical histories, and they're about 200 pages. No one has the possibility to read all this. So there will be in future that we just get a summary and that we will have new ways how we will deal with all this information. All these together, artificial intelligence, smart devices, telemedical support, I think that this will allow us to perform medical treatments and medical care in regions where they have no medical support. And this is right now that 4 billion people on the world, they have no medical care at all. So I think that at least these technologies will help us to more or less to perform medical care even in these areas where there are no resources, no financial resources left. Personalized medicine, I think this is very important if we're not talking about just genetic problems, if we're talking about behavior, are we smoking, how much exercise, and so on and so forth. So this will be important, and the first steps are already done. This is Pepper. Pepper is a social robot. She's already existing. And she has the possibility to interact with older people. She's asking them, how do you feel, how do you behave, and then she's trying to motivate them to perform exercises. And this is really very important because we know that if we want to become old in a healthy way, there are three things we have to do. One is exercise, the other thing is caloric restriction, less food intake, and the other thing is that there are several drugs where we know that they have a possible or a good influence on aging. But exercise is really important. So, and this robot is really enforcing to do more or less exercises, and the biggest plus is that you also have the possibility to analyze these movements, if they have been performed in a sufficient way or not. And she's interacting with them. Do it a little bit more in this way. So this is really a possibility to interact with the elderly. Okay, so it's just a movie, an actual movie, which is dealing with the problem that a robot will be a very important part, especially for the elderly. So what they will do, or what all these robots will do, is that they at least they activate the older people to think and to keep their brain more or less active, like you've already heard in the presentation before mine, that this is really very important, and the brain is just a muscle. You need exercise. The other one is physical activity and so on. So all these aspects will become very important, and they're already here. So they will become realistic, or they will be established. So this is not fiction, this is really science. Assisted ambient living, this is already done, and this will be a very important part in our life, because there's already one definition about health. And the new definition of health is not like in the past, the absence of symptoms. This was the definition of health 10 years ago. The definition of health is if an old person has the possibility to live on its own, in his own surrounding. Can he live alone? So this is more or less the new definition of health. And what we try to do is that we want to enforce the people that they can stay at home as long as possible, because the hospital is not the ideal place for an older person. All this is just possible because you see that medical care is not only a doctor anymore. It's about technicians, development, research. All this can just be performed within a network. So like I've already told you, that I'm a plastic surgeon working at the university, but also at Univ Research, which is very active in technological developments. So all these we have to work together. And then we have the possibility really to change how the healthcare will be in future. These are some of our partners, so we are very active in the way that we try to modify healthcare in future. Majority of the presented things which are presented in the science fiction movies are not fiction anymore. They are really part of science, and they will be clinical routine in a very short period of time. Thank you very much.